Welcome to my office in Laguna Beach. I am Dr. Anita Wong. I am a board certified emergency medicine doctor and a fellow in anti-aging metabolic functional medicine. I see people at their worst, and now I want to prevent people from becoming their worst. I see patients in the office with very strict COVID protocols and virtually working on immune resilience. Um, in office, I do anti-leaking, anti-sagging, anti-loss of muscles. Um, Come in and learn about those things and come in for a complimentary demo. My desire is to help as many people as possible, and my goal for myself and for you is to live long and die well. I just want to mention that with the numbers of COVID on the uptick, and we haven't even reached the peak of all the Thanksgiving gatherings. There is a field hospital for OC that is opening up to lessen the burden of the hospitals because beds are getting short, ICUs, ERs are getting undated, and there's going to be an overflow. So I just want to remind everyone that the vaccine is not a magic bullet, that the public health measures do make a difference. In addition to good nutrition, health is important and something that you can do while you're waiting for that vaccine. Because even with the vaccine, you're still going to want to wear a mask. Even eye protection is really key because you can get it there. Taking your vitamin C, vitamin D, having a low deficient vitamin D is really, you know, has been bad for this COVID. But people who have adequate vitamin D, there's a 95% chance of you, if you're in ICU, not progressing to the ICU if you do get COVID. So make sure your vitamin D is adequate. Zinc is also a very antiviral. Quercetin, things that I use to make sure your glutathione is elevated. People don't talk about their other treatments, and they really think that there's been a void in everything that what we're doing in terms of. Oops. Sorry, that we're live, so things happen, right? But when there's the acute care, and we're talking about the acute care with remdesivir, monoclonals, antibodies, everything that we do with acute care, getting the chronic, and post-care prevention in terms of vaccines we're doing. But what about when you get it? What is the recommendation now is basically there's no treatment. But I want you to feel that there is not that once you get it, there's nothing that it can be done. There are things, and I think that the data is going to prove out. I just think it's unfortunate that we didn't put a lot of stock into doing research to finding that because we're doing everything for the vaccine, which is very important too. But I think also having treatment is also very important. So things that we do is IV vitamin C, IV ozone, IV glutathione, even inhaled glutathione can be helpful and really help with people with long haulers. Peptide therapy is important, is very helpful. Mushroom therapy, there's all of these can reduce your symptoms, prevent you from becoming severe, and there are some studies going on now, but there have been good outcomes with this. In terms of the vaccines, what I wanted to just mention about the vaccines is that they are novel vaccines, right? So, and the reason why we got to up speed so quickly is because SARS and they had already were trying to develop a vaccine for the COVID virus at that time. And so they were in phase 2 when we got COVID-19. So they were already ahead of the game. And it's a novel because usually you use an antigen like mercury, or you use an alloy like tin, and these are reactive to your body and not healthy. This is now they're taking the genetic factor and using uh, uh, I don't know what's going. Anyway, doing alloy. So take messenger RNA into your cells. So that's Pfizer and that's Moderna. And the study showed that there's no severe outcomes, no hospitalization, less severity. So very effective. Efficacy is very good, higher in the 90s. AstraZeneca takes a chimpanzee, the gene from it's a DNA, and it takes the gene from the DNA, and then takes the sequence out and puts the gene from the virus, and then they insert it, and then that DNA causes them to make the RNA in the cell, and then that RNA is the virus, then your body will produce the antibodies. So these are very different ways of vaccines. The final data will come out on Pfizer in December 17th. I think Moderna's was coming out today. Once all that data is coming in, then we can actually really take a look and say, you know, how safe is this, and you know, what will we be taking this, and you know that there has been some anaphylactic reactions in people who had histories of severe allergies. The question that I had with the Pfizer is because of the deep freeze that it has to be in, super deep, super cold temperatures, and then how are you going to stabilize that, and then have to buy a freezer, and then the doctor's office is a pharmacy, or they can really, well, Pfizer's really come up with a good, so that's not a problem. They've taken about, you know, 5 personalized pizza size boxes, stack them up, and so it's pretty small, can fit under a desk, and it holds about 1,000 vials, and you put dry ice around there, and then you just keep replenishing the dry ice. You get special goggles, you get gloves, so when you take it out, you don't freeze, and then you let it sit out till it gets to room temperature, then you can administer it. So they've come up with a really unique way of doing this. I don't know how to disconnect that because I don't think it's on my phone. It's off. So anyway, so my recommendation before we get to finding out the full safety of the vaccines and whether or not, and to be able to take vaccines, because vaccines have eradicated diseases, smallpox, polio, very important vaccines. So my recommendation is to make sure you eat right. So all the binging of alcohol and comfort foods, you want to, and sweets, you want to minimize it and try to eat more fruits and vegetables. You want to sleep well. You want to exercise well, right? You want to make sure you're not zinc or vitamin D deficient. Take vitamin C. If you do get COVID, you want to search out those alternative treatments for ozones, glutathione, NAD, peptide treatment. And I said, I do think the studies is going to bear out. And also, if you've lost your muscle mass, and you know, you're suffering from diastasis recti, there is, which is a complete or partial separation of the abdominal muscles. You know, your 6-packs down here, and so the midline of your abdomen sticks out, poaches out. Well, there is and you know, this happens in pregnancy. 60% of the women who are pregnant get this, and if newborns have it, men even who've lifted heavy weights incorrectly or performing excessive abdominal exercises also can have this complete separation. And they're usually they'll do surgical procedures for that, but I have a non-surgical, non-invasive treatment for this. And the wonderful thing about the side effect is that you lose the bad internal visceral fat, and you also lose the fat in between the muscles, so it gives you definition. So they get hypertrophy, hyperplasia of the muscle. So it is it is a steroid, but not a medication, but a electromagnetic frequency that contracts your muscles at a higher intensity that you could do that. And then once you have more muscles, that boosts your mood, it helps your weight control, helps with your sleep, overall health and longevity. Prevents you from getting frail and tripping and falling, because when you trip, You catch yourself with your core. If you're too weak in the core, you can't catch yourself, right? So if you are looking, I also want to mention, it's maybe just a reminder, because that same technology I use for incontinence, so it helps with the pelvic floor. So keeping your core to the floor intact helps with that. Intimate health, incontinence. I use some radio frequency for the sagging all over the body. Some people have it over the knees, um, around the arms. But and if you're looking for a unique gift for this season, because it's a very unique year, and you want to give something that's long lasting and a gift of love that would improve quality of life and vitality, last a long time, think about these treatments for incontinence, because there's no more embarrassing moments. They can be dry, or movement of stronger. Their core and their pelvis is stronger. Their immune system, working on their immune system support, having tighter skin, looking younger. I can personalize a gift certificate for you, for your special loved ones if you desire that. Just give me a call to discuss your options, and we can make a special gift certificate. Um, so that's it I have for today. And as always, if you find these messages useful, please share, like the page, pass it along, share it with your friends and family. And if you want to have a chat with me, go to my website, anitawang.md.com, and schedule yourself a complimentary discovery phone call or a complimentary demo for any of these devices that you might be interested. Give me a call at 949-734-0580. Till next time, be safe and well.